Welcome to this week's edition of Health Insurance Today on radio, on Lagos Traffic Radio 96.1 FM, the show that educates and brings you the latest information on everything health insurance. This program is brought to you by A-Star Communications Limited. And today, I'm your host. My name is John Omoaka. Well, last week we discussed the topic, you and your health. Safe use of medications, during which a pharmacist educated us on the use of safe medications and how having a health insurance plan can help to manage the cost of medications. And well, of course, we thank you for your calls, for your feedback and inquiries about that episode. And we hope you learned a two, or better still, you learned some lessons, all right? Well, on today's show, we shall be discussing understanding common eye conditions, a very important topic that promotes the care of the eyes. Our guest is an expert in eye care, right here with us in the studio to share this useful insight with us. Should you have any questions on the topic, you can call into the studio or send us a message on our studio telephone lines. And that's 0809 912 0777, or you can call using 0915 3877 127. And of course, our expert will answer your questions on the topic of the day. You're still on to Health Insurance Today on radio. And joining us in the studio today to discuss understanding common eye conditions is Dr. Chidi Patrick, an optometrist from Berracah Eye Clinic, right here in Lagos. And he is also the acting public relations officer of the Nigerian Optometric Association, Lagos State Chapter. Dr. Patrick, you are welcome.
Thank you very much.
So tell us, what are some of the most common eye conditions affecting Nigerians today?
Okay, thank you very much for having me today. I'm so glad you invited me here today to discuss this.
Yeah,
so
welcome.
Some of the common eye conditions Nigerians battle with include refractive errors. And refractive errors are conditions where the eye, when relaxed, are unable to bend light correctly into the eyes, onto the retina. This brings about distortions of blurry images for the individuals. And some of these conditions include myopia, hyperopia. Some persons may call it hypermetropia or long-sightedness. Then we have astigmatism, presbyopia, and then aside this, we have cataracts, we have glaucoma, we have dry eye syndromes, we have age-related macular degeneration, diabetic retinopathy, corneal opacities or corneal problems, and so there's so many of them. These are some of the basic conditions Nigerians suffer.
Wow, so much. So in all of these that you've mentioned right now, what are the common symptoms of these conditions that people should be aware of? What are the symptoms? That indeed I have a eye problem or something.
Okay, the commonest of them is blurry vision and photophobia or sensitivity to light. Then we have difficulties, what we call squinting. When someone's trying to see very clearly, he squeezes his or her eyes. Then there's headaches or eye strain. There's also difficulty seeing at night. Some of them also come in form of pain, so those are some of the basic symptoms.
So if you notice all of those things, that means you have eye problem?
Exactly.
Wow. Okay, Dr. Chidi, tell us about the risk factors. Are there risk factors for some of these conditions?
Of course, there are risk factors. These risk factors are basically genetic in nature. Some of them are Some of them are age-related, and some of them are due to prolonged exposure to maybe UV radiations. Then for children, for instance, increased screen time could be a risk factor. Poor diet or poor nutrition could be involved. Then health challenges, for instance, in diabetes, could be a risk factor. Yeah.
Wow. So in all these, risk factors you've told us, are there specific age at which one can have the, these eye conditions, problems?
Most eye conditions begin to manifest usually at age 40 or higher. These risk factors are usually higher when one is over the age of 40. There's a study that says some persons at 60 are 8 times more prone to eye conditions or eye problems than their younger counterparts.
But Dr. Chidi, I've seen little children also with eye conditions.
Of course.
How about that?
Yes, little children come up with eye conditions. Of course, we're in the age where children are going back to school. So some of these children inherit some of these conditions.
So they're genetic.
Yes, that's where the family history comes into play. Now, we are also aware that some of these children also are exposed to increased screen time. Some of them play, a lot indoors. Some have fewer friends. For instance, if a child who doesn't have more friends, for instance, may not know the reason for that. Maybe because of his or her vision.
Wow.
Because imagine a scenario where a friend is waving at you from afar, and because of your inability to see that person, you're unable to return the favor. And that other person feels like you're snobbish.
Yeah.
And so most of them tend not to have friends. So family history comes in.
Okay.
Children are also prone to a lot of eye conditions too, depending on what they are exposed to.
Wow. Thank you so much, Dr. Chidi Patrick, for that insights. But right now we have to, give the listeners some update, traffic update at this moment. Please stay tuned. All right, looking at Alausai Keja corridor, I hear that vehicular movement on Obafemi Awolowo Way is moving fast from Barracks, Coca-Cola Junction, Radio, Allen Junction, and Balogun is slightly busy, and that's due to traffic light alternating at Ikeja underneath the bridge, and service applicable on the return journey. Latif Jakonde Way is moving at a fast pace from Coca-Cola, Daily Times, Cadbury, approaching First Gate is gathering momentum, and that's due to high influx inward Omole roundabout and traffic light alternation. Well, vehicular movement from Arumire inward Adini Jones is gathering momentum. Avenue to Secretariat intersection and the entire Dr. Nuruddin Lopopo to connect Otedala underneath the bridge is not a bad one. Straight away, let's out Papa. It says vehicular movement from Ajeromi Ifelodun through Ballet Street to Boundary Bus Stop is a fast-moving one. And then the movement of vehicles around Boundary Roundabout is slow as a result of commercial activities and the evening rush hour. And then from Boundary to Arakan, military cantonment is good to go. Total Bridge ascending to underneath the bridge through Navy Junction connecting Naval Dockyard is not a bad one, but it's a slow movement within that underneath Ijora 7-up bridge as a result of the nature of the road. Marine Bridge bus stop in what Ijora is fast moving, and then the traffic from Ijora through the High Bridge to Total all the way to RRS checkpoint is a fast moving one on both lanes. But immediately after RRS, we have flatbed trucks that occupy one lane, while the second lane is beautiful. The return journey from Apapa Point Road through the Marine Bridge to Igomu is a fast-moving traffic. Health insurance today continues. right, still health insurance today on radio, right here on Lagos Traffic Radio 96.1 FM. We've been talking with guest Dr. Chidi Patrick. And if you also want to ask him some questions or you have something to say about these, the topic for today, which is understanding common eye conditions, you can call our studio lines 0915-3877-127, or you can send a WhatsApp message to 0809-912-0777. All right, Dr. Chidi Patrick, talk to us about the economic impacts of these eye conditions. When we talk about economic, we're talking about money here. So how would you say these conditions affect people's daily lives in terms of their socio-economic impacts?
Okay. You see, vision is so important that when it's absent, it hinders the ability to make money. So basically, it reduces productivity when you don't have vision. And then when you don't have at all, you can imagine there's nothing you can do about it. Although there are people without vision that can focus on other aspects of life. But basically, your life is now, half of your life is more like to channel your, is channeled to other areas. Okay. Now, some of the impacts include, for children, hindrance, low academic performance. Then we have increase in the risk of accidents for drivers, and the overall quality of life is also affected. Take a look at somebody who has lost his vision. He can't see. I once had a patient who complained that he is old. He has lost his sight. He can't see his grandchildren. He can't see the color of the food he eats. He doesn't even know whether the person feeding him likes him.
So sad.
So that actually affects the lifestyle. Then for children, we've also discovered that it affects, it creates anxiety. There are some disorders that can come up as a result of loss of vision, for instance. Anxiety can come in, depression can come in. Some people live in pain. They are not always happy. So their quality of life generally is affected in everything they do.
Wow, Dr. Chidi, all the information right now, it's such a pathetic situation. So in all of this now, are these conditions, eye conditions, are they prevented? Can they be prevented, basically? And how often should individuals go for eye checks? Okay, great.
These conditions greatly can be prevented. A statistic shows that 80 to 84% of visual problems are avoidable.
Wow.
Yes, they are avoidable. So how do we go about it? You need to go for regular eye exam at least once every year. That's the frequency.
Okay.
Because some of these conditions, they don't, they manifest over a long period of time, and the key to nip them in the bud is early detection. So some of them are painless. Some of them, we call them the thief of sight. They don't manifest in any form. So the individuals of the victims don't know that you have this condition. So regular eye exam can help you a lot in detecting these conditions early. A healthy lifestyle is also very important. For instance, when you eat balanced diet, you can improve your vision. But on the other hand, when you smoke, you can inflict other conditions like cataract. Your lifestyle should be balanced. Then we talk about the treatment, which can also take the form of medication, surgery, or even corrective glasses in some cases. So most of these are actually preventable.
Wow, fantastic. I'm glad we have hope. We have hope for those who have eye conditions. All right, so if you have questions for Dr. Chidi Patrick as regards eye conditions, do well to call our studio lines right now, 0915-3877-127, 127, or you can send a WhatsApp message to 0809 912 0777. All right, Dr. Chidi Patrick, from what you have seen in your professional practice, as optometrist, are eye checks or examination covered under health insurance?
Yes. The answer is yes. So most health insurance cover routine eye examination, they cover treatment, they cover surgical procedures in some extreme cases. So the problem we have is most people are not aware of these packages. They can take advantage of it and they will have their eyes examined.
Okay, so talking about those packages now, many people, they complain of high cost of high treatment. So do you think having a high health insurance plan can give people that affordable access to high care and treatment for these conditions that we mentioned earlier on?
Of course, yes. You see, most health insurances come with different packages. It's just for you to present yourself to the clinic and have your eyes examined at first, which is the most important. When your condition is detected, the cure or the treatment will take its course. So health insurances are very good because they give everybody the chance to have affordable eye care.
Wow, that's a good news. So in case you're listening right now, you're wondering, how do I go about this with the economy? So you've heard it there. You got to subscribe to health insurance so you can always have your eye checked and of course treated as well. Okay, we're still looking forward to hearing from you. Call our still line. We have a few minutes to go. 0915 3877 127, or you can send a WhatsApp message to 0809 912 0777. Real quick, let's look at the road one more time and see what has gone down, in case you're just tuning in and you're wondering what is the cause of the traffic, especially around some parts of Alausa Ikeja. Is due to basically high influx right now, and also the traffic lights alternating. And same can be said of the Apapa Jegule corridor, where we also have high influx as well, and traffic lights alternating also, and the nature of the road too, like the Ijora 7-up bridge is causing slow movement due to the nature of the road there. But never mind, we have our traffic managers who are doing the needful to ensure that you still have a very good movement. Still health insurance today on radio, Lagos Traffic Radio 96.1 FM. All right, Dr. Patrick, it amazes you that some people, they try to avoid going to the hospital for medical checkup and all of that. They try to make use of what they call local remedies now. I heard some people use battery water, to put in their eyes for clearer vision, and all sorts of bizarre things. What do you have to say about, trying to seek for help locally?
Okay, I'll say it's advisable you don't go into all those kind of practices, because you end up damaging your eyesight even further. The best result is to go to the nearest eye clinic and have your eyes examined for that condition. Some persons put acidic battery water, which is acidic most times, and you get burns, you get irritations, which could have been prevented. I hear of some mothers who put breast milk, for instance. Some who, blend organic substances, leaves and co, and put directly into these eyes. Now, it's true that most of these things are natural, but they are in complex forms, and they can damage the eyes. So the easiest path is to go to the nearest eye clinic, have your eyes examined and treated properly at even a very reduced cost, because the cost of maintaining a damaged eye is higher than preventing it in the first place.
Wow, well said. I just hope you can say that again for our listener right now. You are an expert in eye care, and so what advice do you have for the listeners in the area of maintaining good eye health?
Okay, I'll advise our listeners to prioritize the eye exams so that conditions can be detected early. Some of these conditions can actually damage the eye if they are not detected early enough. Then I'll also advise them to maintain a healthy lifestyle. Some of those things, like what we just said now, if you put local remedies or local concoctions or whatever sort into your eyes, you risk damaging them further. You seek professional help if you experience any vision problems, and then consider getting a health insurance policy. It will help you a lot. That's my advice for them.
Thank you very much. It is still health insurance today on radio. So as we round off this conversation, Dr. Patrick, we have some people who wear glasses, and so how often should they, have their eyes still checked? Perhaps should you, or is it a lifetime thing that you wear glasses all through your life? How regularly should they go for eye check as well?
When I get these questions, I marvel, because we grow as humans, and change is constant. So when you have your eyeglasses today, you're going to grow, you're going to eat a lot of food, your body is going to go through a lot of changes. So what we advise is you go for your regular checks at least once every year. That way we can detect changes in your vision. And some of these changes, sometimes we want to train the eyes to get better, but the problem is most people won't go for checkup. You think that when you get your glasses, you wear them for life. The truth is, we train the eyes. We also expect the eyes to respond to the treatments that are given. So a regular check will prevent a lot of things,
All right, Dr. Patrick West, we'd like to appreciate you so much. Dr. Patrick, Dr. Chidi Patrick is an optometrist from Berracah High Clinic, Lagos. And he's also the acting public relations officer of the Nigerian Optometric Association, Lagos State Chapter. Thank you so much for sharing these useful tips on the topic, understanding common eye conditions. Also, we'd like to thank you, listener, for tuning in to today's Health Insurance Today on radio. And this is brought to you by A-Star Communications Limited. We hope you found our discussion very, very informative and helpful as well. Do you know that you can actually access affordable preventive care and treatment of eye conditions if you subscribe to a health insurance plan today? And if you would like to know how to subscribe to health insurance plans for you, your family, or organization, or you just want to know more about today's topic, please call or send a message to 09015388634. I say that again, 0901-538-8634. You can also email info@healthinsurancetoday.ng. info@healthinsurancetoday.ng. Don't forget to tune in next week for another fresh package. Same time for more information and insights on health insurance. Until then, stay healthy and stay informed.
Really nice. I take it one. You wanna live long, you wanna stay strong.